All right, let's get into this. We usually think of swelling as just a pain, a minor annoyance. But what if it's actually more than that? What if it's a clue, a message from your body in this fascinating detective story that's playing out right under your skin? I mean, you've been there, right? We've all had that feeling. That puffiness is a super common experience, but it's also the very first clue in the mystery we're about to unravel. It's a physical sign that something in your body's really intricate fluid system is, well, a little off balance. So, the official term for this clue is edema. It's just the medical way of saying swelling that's caused by extra fluid getting trapped in your body's tissues. But here's the thing. This isn't just one story. Edema can be a window into a really local problem, like a bee sting, or it can be a sign of a much, much bigger system-wide issue.
Okay, so to really understand how things go wrong, we first need to visit the scene of the crime. We have to look at this incredibly delicate fluid balancing act that's happening inside you at this very moment. It's this hidden system that's constantly working to keep everything just right.
And get this, your body is an absolute master at hiding the evidence. It can actually pile up around 3 liters of extra fluid. That's like 3 of those big water bottles, before you even start to see any visible swelling. So what does that mean? It means by the time you actually notice it, a lot has already been going on beneath the surface. So this whole complex process really boils down to a battle, a constant tug of war between 2 opposing forces. On one side, you've got the push force, which is called hydrostatic pressure. Just think of it like the water pressure in a hose, always trying to push fluid out of your blood vessels. And on the other side, fighting against it, is the pull force, or oncotic pressure. This acts like a powerful magnet made of proteins that pulls that fluid right back in. When your body is healthy, this whole thing is like a perfectly choreographed dance. First, the push force nudges fluid out to deliver all those good nutrients to your cells. Then, the pull force kicks in and draws most of it right back. And for that tiny little bit that gets left behind, no problem. Your lymphatic system acts like a super efficient overflow drain, mopping it up and returning it to your circulation. Push, pull, drain. It's a perfect closed loop. So, what happens when you see swelling? Well, it means that perfect balance has been broken. And our investigation has turned up 5 prime suspects, 5 main ways this whole system can fail. Let's line them up and start with suspect number 1. Our first suspect is all about brute force. This is what happens when that push force, that hydrostatic pressure we talked about, just gets way too strong. The system is completely overwhelmed. It just can't handle it. A classic example here is congestive heart failure. See, when the heart can't pump as well as it should, the body gets confused. It thinks it's dehydrated and starts holding on to salt and water. All that extra fluid cranks up the pressure inside the blood vessels, physically forcing more liquid out into the tissues than the system can possibly pull back in. All right, let's move on to our second culprit. If it's not an overpowering push, then maybe the problem is a failing pull. This happens when that protein magnet we talked about, well, it just isn't strong enough to do its job anymore. You see this a lot in certain kidney diseases, where the body just leaks tons of protein out into the urine, or in advanced liver disease, where the liver, which is the body's protein factory, can't make enough of it. Without enough of these protein magnets in the blood, that pull force gets really weak, and fluid just sort of seeps out. Now, suspect number 3 isn't about the forces at all. It's about the container. What happens if the walls of the blood vessels, the very things that are supposed to hold everything in, suddenly become, well, leaky, like a sieve? This is exactly what happens during inflammation or an allergic reaction. A great example is a skin infection, like cellulitis. The body releases all these chemicals that make the capillaries leaky on purpose, so immune cells can get to the area. But the side effect? Fluid and protein leak out too. And this perfectly explains why this kind of swelling is often red, warm, and painful. It's an active, fiery process. So we've looked at the push, the pull, and the container. But what about that all-important backup system? Our fourth suspect is really just a simple plumbing problem, a blocked drain. Medically, this is called lymphedema. If those lymphatic vessels get damaged or blocked, maybe from a surgery or an infection, that whole overflow system just fails. And now that small amount of protein-rich fluid that normally leaks out has absolutely nowhere to go. It gets trapped, and it just builds up in the tissues day after day. Okay, our final suspect is definitely the weirdest one of the bunch. It's not about push, pull, leaks, or drains. It's about something strange happening in the tissue itself, something that starts acting like a rogue sponge, actively soaking up fluid. This is the key mechanism in something called myxedema, which is caused by a severely underactive thyroid. In this case, the body deposits these specific molecules into the skin that just love to bind with water. They essentially create little sponges in the tissue that pull fluid out of the bloodstream, and this is what causes that classic puffy look, especially in the face. So, we've got our 5 suspects. But how does a doctor, our detective in this story, figure out which one is the actual culprit? Well, they look for fingerprints, simple, physical clues that help them crack the case. One of the biggest clues comes from the press test. If you press on the swollen area and it leaves a little pit, a little indentation, that's called pitting edema. That tells the doctor that the fluid is watery and low in protein. It points them right towards suspects like pressure overload or pull failure. But if it's firm and doesn't leave a dent, that suggests the fluid is thick with proteins or other stuff, pointing them towards a blocked drain or maybe even that rogue sponge. And just like in real estate, it's all about location, location, location. Is the swelling just in one leg? That screams local problem, something like a blood clot or an infection. But is it on both sides of the body, like in both ankles? That points the whole investigation toward a systemic, a whole body issue, a problem with the heart, the kidneys, or the liver. So as we wrap up our little investigation here, it becomes so clear that swelling is way more than just a symptom. When you actually understand the mechanisms, you can start to read the story that the body is trying to tell you. There's this quote from the source material that I just love. While a lab result is data, the mechanism is wisdom. And it's so true, right? A lab result gives you a number, a piece of data, but understanding why that number is off, what actually broke down in that system of push, pull, and drain, that is real understanding. That's wisdom. So let's just boil it all down. The big takeaway is this. Swelling is a physical clue that your body's fluid system is out of balance. That balance depends entirely on that constant dance between the push of pressure, the pull of proteins, and the drain of your lymphatics. When swelling shows up, one of our 5 suspects is to blame, and doctors can use simple clues like where it is and whether it pits to figure out who done it. By learning to see symptoms not just as problems, but as puzzles, we get this much deeper appreciation for the incredible, complex machine that we live in. It really leaves you wondering, what other stories is your body trying to tell you right now?